guys, you're welcome to another edition of my program called Health Talk with Queen Nikki. How you guys doing? Yes, I am back again to my health teaching. You're welcome to my program called Health Talk Queen. Okay, so what's gonna be our topic today? Y'all have seen the topic, management of fever. Yeah, management of fever. So this fever is gonna be generalized, not only for pediatric but also for adult. Okay, so let's go right into it. But before I start, have you subscribed to my YouTube channel? If you haven't followed me on YouTube, what you waiting for? Come on, follow me on YouTube. My YouTube handle is called Health Talk Queen 1. Turn on the post notification so you can get notified when I drop a new video. Are you following me on Instagram? What are you waiting for? And also on TikTok, it's called Health Talk Queen. Okay, let's dive into it. So as nursing perspective, so as my normal demand topic, people ask about fever management. Okay, so fever, we're not going to be going into pathophysiology like I always say in every of my disease process. So we're just going to go straight to the management of fever. Fever is when you have change in your body temperature, and it can be due to so many reasons, but the major reason is infection. When you have infection process going on in your body, you tend to get fever. So how do we manage fever when we have it? Fever can be due to respiratory infection, gastro infection, cardiac infection, any infection. It can be due to it. But the management is the key factor that can help us in reducing the fever. Now, fever in adults. When an adult has fever, as nursing teaching perspective, that we encourage our patient to do this following thing. Number one, when you feel like your body is hot inside, what you need to do is, number one, take your your temperature. When using your thermometer, once you take your temperature and you find out that it's fever, and I'll be putting supporting pores to support what I'm doing and what I'm saying after I download this TikTok video. So once you take your temperature and it's fever and you had fever, number one, what you need to do, depending on how high the fever is, you can go ahead and take over-the-counter medication. Over-the-counter medication. Number one, over-the-counter medication, you don't need doctor prescription for that. So what you do is take Tylenol, Motrin, and if you're in Africa, you can take Fensic and other stuff, or paracetamol. You can take it and then you feel better, which I don't like to discuss about medication on my program. So once you take fever medication, then you can proceed into taking cold bath. This time around, you need cold bath to cool your body temperature. Once you take it and take a nap, you should feel better afterward. You should feel much, much better. Now, with the kids, when it comes to children, once you take temperature, there are so many ways you can take children temperature. You can use the one, they have it over the counter here in America and also in all over African country. You can take it in their mouth, or you can take it under their armpit right here. You can take your temperature under their armpit. You can take it in their mouth. And sometimes you can take it in their rectum area for children less than maybe between 6 months old and to 1 year old. If you want accurate, you can take it there. Once you find out that they have fever, what you need to do with children, you have to be very, very careful when it comes to children. So what you need to do, number one, you give them medication. After the medication, like baby Tylenol, baby Motrin, or if it's children above 1 year old, still give Motrin or Tylenol. Once you give it, but you have to make sure you alternate it. Don't give Motrin and Tylenol at the same time. So once you alternate it, like, as per doctor recommendation or the package recommendation, the package behind the medication recommendation. So once you give it, you can now soak washcloth, put it at the back of their forehead like that. It will help to cool down the temperature. You can also put it at the back of their armpit, like the middle of their armpit like that. It will cool down the temperature. Sometimes some parents go, above by putting it in the groin area. That way their temperatures can cool down. Now, the important factor, if you don't make sure that your children temperature cool down, it can turn to what we call febrile seizure. But before we go there, what are the other steps you can do? After you put the washcloth on them, on their groin axillary area, their groin area, their forehead, once you put it, and make sure that you hydrate them. Make sure they drink a lot of water so that they can get well hydrated. Now, if you notice that, because one thing about fever, when fever breaks, the baby tends to start shaking. That's the process that is breaking. So what you need to do is just take all the washcloth away. Then you can now put the baby blanket just a little bit and light cloth and let the baby take a nap. Take a rest. Now, if the fever continue for days, like maybe 1 day, 2 days, please take the child straight to the primary care doctor office. Call the primary care doctor office, or you go straight to the emergency room, nearest emergency room. So because if you don't do that, it will cause febrile seizure. Now, febrile seizure in kids can be of different, it can show up in different way. Number one, you can see the kids start shaking like that, and their head will roll back, or it can be tonic-clonic, it can be abnormal movement. You know that it's febrile seizure. In that instant, please call 911. And if you're in Nigeria, take that child straight to the emergency nearest hospital, because febrile seizure can be dangerous in children. You want to make sure that the child gets immediate treatment as soon as possible. Now, while you're waiting for the emergency response to come to your house, make sure where the child is, it's clear of cluster area, is a very clear area, dry area, clear area of cluster thing that can make the child have injury, because with seizure, they are shaking, abnormal movement. So you don't want the child to injure his or herself. And then bring out your paper and pen, write when the seizure starts and when the seizure ends. When the seizure starts and when the seizure ends, very important. And also, what is the quality of the seizure? What is how describe the seizure? It's very, very important for the healthcare provider to know the treatment, because these are the questions they will ask you. How long is the seizure? What happened before the seizure? After the seizure, what happened? Did the child lose consciousness? If the child lost consciousness, start CPR immediately. Those are the things that we need to know. That's why it's recommended. In my video, I've talked about CPR, that is a must for every parent to have CPR teaching. Okay, so let's proceed. Once you do that, when the response team comes, they will take over. That's why you have to break fever when it comes to children, so that they don't end up having febrile seizure. I'm still going to be coming back to talk more about seizure, and I'll mention the procedure and the teaching when it comes to febrile seizure. Okay, so overall fever is a very important thing that we need to break in both adult and also in children. Now, remember the key thing: when you have fever, take cold bath. Make sure you take your medication as per doctor prescription, and also hydrate yourself and rest. Sleep rest, and then you should be fine. If the fever continue, go to the nearest emergency room, because it might be underlying disease process that you don't know, and you want to be safe. Okay, thank you so much. I hope you're learning. If you want me to treat more other important topics, email me at www.healthtalkqueen@gmail.com. Till I see you in my next video, remain blessed and enjoy the rest of your day. Bye and God bless.